local and federal officials are now looking toward reopening the economy and easing up some of those social distancing guidelines. We're checking in with MU Healthcare to see how they're continuing to deal with COVID-19. We're joined now this morning by Dr. Mark Wakefield. And Doctor, thank you so much for being with us this morning.
Oh, you're welcome. Good morning.
Good morning. Now, a lot of people are looking toward that light at the end of the tunnel. How is MU Healthcare starting to plan to reopen the hospital in some capacity?
So we're trying to be in concordance with local, state, and national recommendations to emerge from our level 3 policies for safety and operating of the hospital. Some principles that we're going to use are: how do we keep our patients safe, how do we maintain social distancing, and how do we keep staff safe, and how do we preserve PPE. So in the near future, I think we'll start having increased access to clinics for in-person visits, and we'll start increasing our scheduled surgeries that can no longer be deferred.
What's some of the potential dangers we could see when we remove some of those social distancing guidelines, maybe too quickly that some people might think?
Right, so I'm especially worried about the waiting room. You know, think about our previous model of the waiting room. People wait to see the doctor, they congregate in a closed space. And if we go back to that too quickly, then there's a risk of community transmission again, of minimally symptomatic people in the waiting room. And then we'll have a surge of patients who are sick, and we may not have the capacity to take care of them because we've utilized our PPE in our routine care environments. So I think we have to have a deliberate strategy to take care of avoiding this second emergence of community spread that we've seen in other locations.
Okay. And what's the status of bed space at MU Healthcare right now?
We're doing well on bed space. You know, we've limited scheduled surgeries. We don't have elective admissions, so we have capacity. We have running about 30% of the volumes normally done in the operating room, only doing emergency surgeries or surgeries for cancers that can't wait, as an example. So we have capacity. We have, a couple weeks ago, there was a lot of concern in the community about adequate ventilators and ICU space, and we're doing well with potential capacity for that if there is a second surge.
And we've kind of seen some national data models show that Missouri's actually already passed their curve, where we've already, exhausted some of those ventilators and bed spaces, and we've done fine. Is MU Healthcare also on that same guideline that we've already hit our peak?
I think we're considering that to be the possibility. You know, right now we've only really tested in the community for symptomatic patients, so we don't have a good idea about what the rate of minimally symptomatic people in the community are. But I think if you look at the numbers, we're probably at or passing the peak of new diagnosis. One of the challenges is that patients become severely symptomatic sometimes up to a week after they've been tested positive. And then patients who are really sick are in the ICU for a long time. So the capacity influence of being past the peak affects different parts of the hospital differently. I think you can start to see increased in-person visits in clinic, but we may want to hold back on elective surgeries, for example, that have a high likelihood of utilizing the intensive care unit.
Okay, Dr. Wakefield, thank you so much for being with us this morning. We'll check back in with you coming up in about 20 minutes. So again, thank you so much for your time.
You're welcome. Thank you.
And we're checking in again with MU Healthcare's Dr. Mark Wakefield this morning to talk about the latest efforts to battle COVID-19. Good morning, Dr. Wakefield.
Good morning.
And I wanted to jump back in. We were talking about kind of MU Healthcare's efforts to reopen the hospital, of course, slowly and in some capacity. What's kind of been the biggest change for MU Healthcare during this time?
Well, we dramatically and quickly decreased the volume of number of patients that we saw in the clinics. From an average of more than 3,500 patient clinic visits a day to less than 500 in person. And then we dramatically increased our capacity to see patients through telehealth, either video or telephone visits. and we've done more than 1,000 of those visits in a day. We benefited from changes in regulations to allow us to do that quickly, but it's dramatically changed the way we operate in the clinics. And for certain, we have patients, I personally have patients that benefited from not driving into the hospital, finding parking, waiting in a waiting room for a clinic of mine that usually runs late. And as there's not a need for a physical examination, it's a good substitute and an efficient substitute for some of our clinic visits as we go back to a new normal. So that's been a dramatic change for me personally, and I think for the better for the most part.
So as you guys will start allowing more people to come in, maybe more surgeries to be scheduled now, do you think that telehealth communication will still see an increase during this time?
Yes, I think in the long term it may represent in some specialties a quarter of our normal visits, and in others up to a half of our visits a year from now.
And a lot of people kind of have their eyes set on a treatment or possibly antibody test for COVID-19. How is MU Healthcare playing a role in the search for treatments?
Well, for treatment, we're actively participating in a research trial testing convalescent serum. So this is antibodies from people who've recovered from COVID-19 given to critically ill patients in the hospital. And we're participating in a national trial to see if this is effective. There's been a lot of things tried. There hasn't been very good science, and some things that got a lot of press have now been shown not to be beneficial. So that's one of the real challenging things.